coronavirus update. This is your morning of February 12th, 2020 update, and this is from the New York Times. All right, so let's get into it. Coronavirus updates. Virus is said to spread through apartment buildings' pipes. Dozens of people were quarantined at a Hong Kong housing complex after the virus appeared to spread through the building's pipes. The number of total cases in China topped 42,000. So here's what you need to know according to the article. And these are things that are going to be covered in the article. There were 2 infections on different floors in one Hong Kong building, raised fears of spread. In China, the official death toll is now 1,016 people. And if you recall, yesterday it was 908. So that would be 108 additional deaths. And they talk about the numbers below, so we'll get into that. An evacuated American tests positive for the coronavirus. Cruise ship was denied entry to at least 5 countries, despite no signs of illness. First officials ousted for mishandling outbreak. And of course, accusations of racism. A cruise line rescinds ban on Chinese passengers. 2 infections on different floors in one Hong Kong building raise fears of spread. Hong Kong officials evacuated and quarantined dozens of residents of an apartment building after 2 people living on different floors were found to be infected with the coronavirus, the authorities said on Tuesday. The 2 cases appeared to suggest that the virus had spread through the building, perhaps through a pipe, raising new fears about the virus's ability to spread. Officials from the city's Center for Health Protection said that the decision to partially evacuate the building was made after the discovery of an unsealed bathroom pipe in the apartment of a newly confirmed patient, a 62-year-old woman. She lives 10 floors below a resident who was earlier found to be infected. In addition to the infected residents, 4 other people living in 3 different units displayed symptoms of the coronavirus, according to Sophia Chan, Hong Kong's health secretary. In all, quarantines were ordered for the residents of 23 units of the Hong Mei House, a building on the Chung Hong Estate, a public housing block in the New Territories section of the city. The local outbreak prompted comparisons to an incident in 2003 when 329 residents of a housing estate in Hong Kong became infected with SARS. The virus was later found to have spread through defective piping. 42 of the infected residents died. It says here, according to Frank Chan, our initial understanding is that the relevant household may have done some remodeling work on their own. Mr. Chan denied that the recent cases were comparable to the 2003 outbreak because of the location of the pipes. In the earlier case, the pipes were outside the building and the SARS virus was spread through the air. At a government-organized news briefing on Tuesday, a professor, a microbiologist at the University of Hong Kong, said the situation this time appeared to be different. But he said that authorities were not ruling out the possibility of an airborne transmission of the virus. Scroll down here a little bit and cut through some of the stuff here, but it says on Tuesday afternoon, police had blocked off the building, only allowing in residents who showed identification. A street cleaning vehicle sprayed down the road outside, even as light rain fell. As a group of journalists watched outside the police line, a small bus drove out with a handful of masked residents. The driver was wearing protective coveralls, a mask, and goggles. Most of the residents of the house are 60 or older, which obviously we've heard that, and this is the case with most diseases, the elderly, the young, the sick, they are the most susceptible to catching symptoms of any kind of virus like this. If this turns out to be something like that SARS case where it is able to spread through pipes like that, and can you imagine if it could spread through, say, the ventilation system or the ducts in the air conditioning? I haven't heard situations like this in other localities and everything like that, but it doesn't mean that it's not possible. So certainly they're wise to try to get ahead of this, especially as we read in the article there with the whole SARS incident that happened in the ultimately 329 deaths. Definitely wise to get out in front of it. In China, the official death toll hits 1,016, which I had mentioned a little bit earlier. The death toll from the coronavirus epidemic is continuing to climb, Chinese officials said Tuesday. The government put the new nationwide figure at 1,016. That was up 108 from the day before when it was 908. I talked about this in my video yesterday. The 97 deaths in the prior day were actually a new record. So 108 deaths now, which would set a new record. I guess in a bit of somewhat positive news, the number of cases infected, even though it grew to 42,638, up from the previous day's total of 40,171, the increase was roughly about 2,500. And if you keep in mind yesterday, the increase was a little bit over 3,000 new cases. So it's a slight decrease in the number of new cases. if you're really trying to look for a silver lining, I mean, if there is one, there isn't, of course, but you can only try to look at the positive aspects of some of this stuff. Deaths in the Hubei province, the heart of the outbreak, drove the increase. There were 103, though the number of infections reported there actually declined somewhat. And we saw that there in the numbers reflected in China overall. An evacuated American tests positive for the coronavirus. One of the people evacuated to the U.S. from Wuhan last week is infected with the coronavirus, UC San Diego Health said in a statement. The CDC shared the diagnosis on Monday morning, the hospital said. The patient had previously been discharged after testing negative. The patient, one of 167 passengers on a State Department-arranged flight from China that mostly carried American citizens, has since returned to the hospital near the Marine Corps Air Station Miramar in San Diego. It's the 13th confirmed case in the United States and the 7th in California. Other government-arranged evacuation planes from China have taken passengers, more than 500 in all, to Nebraska, Texas, and other bases in California in the last 2 weeks. Those evacuated are expected to be quarantined for 14 days with frequent checks from medical personnel to determine whether they have developed fevers, coughs, or other early signs of the virus. And I actually was watching some more information today, other videos, and I heard some people saying that the incubation period could be as long as 24 days. At least that was the belief. So you have a situation where if they're just looking at quarantining people for 14 days, that may potentially not be enough. So be on the lookout for that kind of information. Extended period of time where the disease can incubate and the potential for a longer quarantine to be needed. A cruise ship was denied entry to at least 5 countries despite no signs of illness. Now it says here, a Holland cruise ship with more than 2,200 people aboard was denied entry to Thailand on Tuesday over fears that passengers may be carrying the dangerous coronavirus, bringing the total number of ports from which it had been turned away to at least 5. The ship, the Westerdam, which departed from Hong Kong on February 1, has already been turned away at ports in at least 5 countries, including the United States territory of Guam, the Philippines, and Japan. Thailand, which has reported more than 30 cases of the virus, had earlier agreed to let the ship dock in Bangkok on Thursday. But according to the health minister, who posted a cryptic message on Facebook Tuesday saying, "I have issued orders, permission to dock refuse," with a cruise ship emoji. Okay, I mean, I guess. I don't know why you would put an emoji there on Facebook, but what can you say? Holland America has said that no one on board has come down with the virus. The ship is not in quarantine, and we have no reason to believe that there are any cases of the coronavirus on board, despite media reports, Holland America said in a statement on Tuesday. The ship is said to have 1,445 passengers and 802 crew on board, was originally bound for Yokohama, Japan. It's unclear where the ship is headed next. A country may be more willing to accept the cruise ship once it has been afloat for the standard 14-day quarantine period and has no reported cases of the virus. The company said that all passengers would receive a 100% refund and 100% credit for a future trip. The ship was providing free internet and phone access to passengers, the company said. Now again, I talked about this in just the last segment where what I've heard, and I don't know if this is entirely true or not, but there's a period where the incubation, we're talking incubation period versus quarantine period, of course, but if the ship just set sail on February 1st, it's still possible, if you think about the 24-day incubation period, that somebody on that ship could have the virus and have not come down with the full symptoms of it yet. So my feeling is that Thailand here is wise to have done what they did. You always want to play it safe, always. I think you owe it to the people of your nation. You owe it to everybody in your country to do what's in their best interests. And sometimes those are hard decisions, right? Sometimes we have to do things that may seem unpopular on social media. But in the end, the reality is you'll have people who complain on social media, which you'll see with the next thing I'm about to read. But the reality is you really can't get too caught up in that. You can't get too caught up in looking bad in the eyes of a bunch of people on Twitter or Facebook. You owe it to your people to do what's safe, and sometimes you're erring on the side of caution, and that's just my opinion. Now, my cynical side tells me, why even report what's said here? Why do I even care that the passengers would receive a 100% refund and 100% credit for a future trip? Well, of course they are. Of course they are. You don't even have to tell me that. I know that already. Again, that was just my cynical nature, though. First official ousted for mishandling the outbreak. The good old CCP dismissed 2 health officials in Hubei, the province at the center of the epidemic, the state-run media reported on Tuesday. They were the first senior officials to be punished for the government's handling of the outbreak. They were replaced by a deputy head of the National Health Commission, whom Beijing dispatched to the region 3 days ago to take over the provincial government's response to the crisis, according to the media reports. Now, of course, we know how it is when you're talking about the CCP. It's a situation where ultimately saving face is the main thing. So they would definitely be looking to fire individuals, even if it was kind of like done in a ceremonial way, if that makes any sense. These individuals may just have been reassigned somewhere else within the government, because the reality is for them to have attained these positions they have, that they would have had some loyalty to the CCP to begin with. So you would think that this is more of a media thing, where they're just, like I said, trying to save face, and that those individuals are probably going to be reassigned somewhere else within the government once all of this dies down, if it does indeed die down. So here's what I was talking about with social media and how you really have to ignore it. But companies don't. They'll never learn. After accusations of racism, a cruise line rescinds ban on Chinese passengers. The Royal Caribbean Cruise Company on Monday rescinded its ban on Chinese passport holders on board its ships. But the company's reversal is little comfort to one passenger, Xiao Lu. Miss Liu, a 34-year-old scientist at Princeton University, arrived in Port Canaveral, Florida on Friday with her husband and 3-year-old daughter to board a cruise ship called Mariner of the Seas. A healthcare worker checked their temperature and asked whether they had been in contact with anybody from the mainland recently. They answered no. The worker did not allow Miss Liu on the cruise ship because she carries a Chinese passport. This is clearly racial discrimination, said Miss Liu, who moved to the United States 11 years ago. What makes me different from other passengers? My Chinese passport, she questions. And the reality is that she's been here 11 years, but she already knows how to work the system. She already knows what kind of isms to throw out there. And it's not a matter of your Chinese passport, it's a matter of China being infected. And while I get that you paid for a vacation, you wanted to take your kid on there and everything like that, it's more a matter of, as I said earlier, companies, countries doing what's ultimately in their best interest, trying to keep passengers safe, trying to keep its citizens safe. Obviously, I get that somebody in that situation isn't going to see it that way, but like I said, it shows you that it doesn't take long for somebody to be acclimated to the ways of the United States, that the first sign of anything being done against you, you pull out the ism card, rather than acknowledging the fact that we've got now over 1,000 people dead, 40,000 people infected in China, and you're Chinese. So that's just my take on it. I always err on the side of caution. I would advise others to do the same. I don't fault Royal Caribbean for banning passengers. It says here they've also banned passengers holding passports from mainland China, Hong Kong, Macau, because the governments from around the world were enacting similar limits. Now governmental policies have been clarified, so we have changed this policy, which that's according to Royal Caribbean's Twitter. As the coronavirus has spread, including hitting other ships, Chinese people around the world have faced instances of xenophobia. I think we have to kind of look at what the term xenophobia means to begin with, but I have heard other articles and other people talking about how individuals from Wuhan and from the Hubei province were facing a lot of discrimination when they were going to other areas of China. If individuals knew that they were from those provinces, then they were faced with verbal attacks, physical attacks. Now, obviously, that's not something we want to see happen. We don't want to see Miss Liu get punched in the face or her kid get kicked. However, the thing we know about outbreaks like this is people panic. And I think a large part of that problem is when you have a government who isn't as forthcoming with information as they need to be. Being forthcoming with information would help calm the situation if that's in any way possible. So hopefully what we'll see over the days and weeks ahead is that the CCP and China itself is able to help calm these fears so that their individuals aren't faced with getting the type of xenophobia, as they describe here, the things I talked about, the physical assaults, mental abuse that they've been getting, things like that, just being treated differently because they are from the province. But again, you have to understand self-preservation. And I know that you guys all out there get that. If we know that 95% of people carrying this disease have come from one country or are a particular ethnicity, you have to really understand that countries, businesses, they have to do what's in their best interests of keeping all their citizens safe. And I understand that it comes with the inconvenience of not being able to take your 3-year-old on a cruise, but my hope is that when the whole family sits back and assesses the situation weeks or months down the road, that they kind of at least can understand where Royal Caribbean was coming from, and people can kind of understand why there's this fear out there. That's all I have to say about the article, though. What do you think about this? The new update, another 2,500 new cases, 108 more deaths. So what do you guys think about this? The situation's really dire, and it seems to be getting worse day by day, even though we're seeing sometimes the numbers are decreasing in terms of new cases, the deaths and everything like this. It's really a bad situation, and I don't really see an end to this until this disease really mutates on its own or until some kind of cure is found. People are scared, and I think they have every right to be. And as I said, though, hopefully that doesn't have a case where people are being assaulted, beaten, things like that in any way. But like I said, you just have to understand that there's a lot of uncertainty and a lot of fear out there. Hopefully soon we start to see a situation where things change for the better. But I don't know. I mean, it's not looking too good. Anyway, let me know what you think. Thanks for watching the video. Leave a comment. Let me know what you think of all this. All right, take care, everybody. Have a good day.